Is it very difficult or not for everybody? Is research something very, very difficult? And secondly, is research all about high technology? These are the two implications for this question. And my answer to both these questions is no. And let me try to explain it further. Scientific research, what is scientific research? One very simple way of putting it would be finding answers to something unknown or uncertain using methods of science. So this will take you directly to another question, that is, what do you mean by these methods of science? Method of science as a very organized kind of thinking is not very, very old. It is something far more recent, I would say something like 500, 600 years. And it starts probably with these people shown in the picture like Galileo, and followed by, I would say Copernicus, followed by Galileo, Kepler, who made observations, and from these observations they came to certain conclusions. And these conclusions were again tested by various means, by further observations. And Galileo and Newton stories went for various experimental ways of actually testing whether something is right or wrong. You know this Galileo dropping two objects from Leaning Tower of Pisa. It's a story basically, but it's very illustrative, you know, about the method of science. Or Newton with his prism and splitting into various colors and making observations with telescopes. All these constitute a new methods, not only methods, but also way of thinking. This way of thinking was, in a way, drastically different from previous ways of thinking, where people accepted wisdom. Wisdom given by very wise people, wisdom given to you by the great religious texts or their interpretations thereof, and so on. But here, this always needed to be tested. And this kind of process in which a hypothesis was made, whether it is tested and found whether is it true or false, that question was asked. And if true, it was selected. If false, it is rejected. So, depending upon something, whether you find it is right or wrong, rejecting things and accepting some was not an older method. It is something very new. And this is what the essence of modern science. And it is this modern science which has proved to be such an extremely powerful way of thinking. And it is this extremely powerful way of thinking that has now allowed us to talk. All of us are sitting in various parts of the country, and we are communicating with each other. And I project a screen here. All of you see this, hear my voice. See, you look behind and look at all the various things that has gone into making this possible. And you know that so many different streams of science and the achievements of so many different streams of science have all come together to make this particular technology possible. So in the last 500 years or so, this new way of thinking, extremely simple to look at, isn't it? But this is an extremely powerful way of thinking. That is an iteration process. Again and again, you choose the right one and reject the false. And this kind of thinking is what is the crux of what we call as the scientific method. And if you go a little more into this, what is this method? What is this method of science? So what I'm trying to tell you is that science is not high technology always. It is not always rocket science. It is even not technology. It is actually a way of thinking. And the characteristics of this thinking, I've just outlined one of them. And if you go a little more deeper into it, what are these, what we call as methods of science? I would say 4 very important methods and 2 which I have added to that. One is empiricism. Empiricism is actually learning by doing things, or learning things from the world that you experience with your senses, seeing, hearing, tasting, whatever it is. From the external world, you learn things and learn from it. That is empiricism. Briefly, I will go a little more into that. Another is, whatever it is, whether it is true or false, this falsifiability thing that we saw in the loop of knowledge. So this something you test and find whether is it false, can it be false or is it true. Then make predictions from your hypothesis, and whatever you find accept as true should be repeatable. Again and again you should get the same result. Added to this, you have what is skepticism, is something very important in science. You always never take anybody's word as the truth unless you are really convinced of it by real argument. And lastly, science is a very open process whereby everything is open to everybody to look at and criticize, and thereby lead to constant corrections. So these are basically the characteristics of what we call as science. Like empiricism. Empiricism by doing things, So on the right side, you see what is the empirical way of gaining knowledge. On the left, you have this knowledge, supposed knowledge by pure thought. Pure thought never leads you to real scientific knowledge. That is why whether it is ancient Greeks or ancient Indian rishis, they never discovered science. You could never go beyond a particular point. And that particular point, beyond that point, we could go only by real practice of things, or empiricism, really by doing and seeing and observing and so on. Testability is another principle, and one philosopher of science known as Karl Popper. Karl Popper was a philosopher of science. He said that one of the things he said is that the most important characteristic of science is falsifiability. So that any scientific theory or hypothesis should contain within it it should be falsifiable. I mean, if you are asking a question in which you cannot get a real answer and say, devise some experiment or way by which you can prove it false, then that idea, that question, if you cannot have that falsifiability criterion, then it is not science. Like asking, is there God? What is the way that you prove whether God is there or not? You cannot. So basically it does not come in the purview of science. Or an opinion, you say that somebody, Yesudas is the best singer in the world. I mean, this is just an opinion. This is not something which can be proved yes or no. So these are not things that come into science. So science, anything that you ask, you should have some observation or experiment whereby you may be able to, at least theoretically, falsify it. And he said that proving something wrong is far more easier than proving something right. And Popper's example was swans. All swans were white. In Europe, you keep on seeing swans. You see more and more and more white swans, and you say that all swans are white. So however much you observe more and more, you can never reach a final answer, 100% answer. But on the other hand, somebody in Australia cited a black swan. So immediately the statement that all swans are white was proved wrong. So you have to modify the statement in a way to accommodate this new idea as well. So testability is extremely important characteristic of science. Predictability is another one. So you make scientific hypothesis, and every scientific hypothesis will bring with it certain predictions. So if those predictions we can test for, and if these predictions are right, then you accept that hypothesis. If those predictions are not proving to be right, you may have to alter your hypothesis. One very most famous example of predictability. Of course, predictability is something that every day you practice in our daily lives. Even especially when we see patients, as I will talk about that later, we are always making predictions and testing, isn't it? So very similar to that, predictability is very important. So Albert Einstein, when he came up with the general theory of relativity, one of the predictions was that the behavior of light with the influence of gravity, light rays may bend in a particular way. And this could not be tested in normal times, but this was tested by Arthur Eddington when a solar eclipse occurred in 1919, I think. So Eddington's experiments to test these predictions made by general theory of relativity, it was proved right. And that was when general theory of relativity was finally accepted as correct. And this was the headlines in the papers that day, just after that particular experiment. Repeatability is another thing in science, that every time that you do an experiment or you look for something, a phenomenon, it has to be repeated. Every time you should get the same result. Of course, within borders of statistical probability and all that other things. I won't go into the details of that, but essentially you should get the same thing. And that is the strength of science also. See, how is it that we have the confidence to sit in a plane and go somewhere in the air in a plane? Because we are pretty sure that all these things made by science, all these products, propellers or jet engines and all other things are essentially going to work. And it is this confidence that lets us do all these things. All the biochemical experiments that you do, biochemical tests that you do in our blood or other things, whichever lab, provided the instrumentation and other things are right, you always get the same result. And this is because of the inherent repeatability of those observations. And the repeatability comes because your hypothesis, basic different hypotheses underlying those assumptions are right. You know something about blood sugar and the way that it behaves. You know how sugar will react with various chemicals. And given all those things, all those things are right, then predictably every time you do a blood sugar test, you should get the same result in a particular or different laboratories. If you do the same blood sugar sample of one person, you should get the same result. That is the example of repeatability. Now, something about science and technology. I mentioned about science and technology. So, actually, technology is just a byproduct of science. Technology, even people who do not know too much about science can also deal with technology. So, but science is the underlying ideas behind it. And it is these underlying ideas which are very powerful, and underlying ideas that are important, and it's these underlying ideas that constitute science. So this is Albert Einstein on the left side. E equals mc squared came from his theories, and it is based on this idea of the energy and matter which can be interchanged. It is this idea that gives rise to, this is Edward Teller on the right side, who was known as the author of the hydrogen bomb. So hydrogen bomb was a technology, whereas real science is in the idea behind those technologies. One thing also about science and progress, this why is it that science is such a powerful thing? Science is such a powerful thing, I said that because of the finding out serially something that is right and wrong, and always going into a new hypothesis and testing that hypothesis, again from that coming to another hypothesis, and so on. So it is a very, very, very progressive kind of thing. That is why in the last 500 years, world has made such a huge, huge, huge change in the world, which in the previous many millennia, it had not occurred. So it is because of this inherent progressive nature of science. I'll just give one example, my favorite example for this. All of you know about chronic myeloid leukemia. I'm sure that all of you have learned about chronic myeloid leukemia. This is a disease in which blood cells proliferate, and you see a peripheral smear there, all different kind of cells. So this was known quite early, 1845. Rudolf Virchow on one hand, John Hughes Bennett, both of them are a German and a British man. Both described this simultaneously about this disease in which there are so many blood cells in the blood and also very huge spleen. So these are the characteristics of chronic myeloid leukemia. Then in 1960s, 1961 to be exact, Nobel and Hungerford, one scientist and another pathologist, they got together and they looked at all this CML patients' blood they took, and they studied their karyotypes, chromosomes, and found that there was one small chromosome which is not seen in other people, that they call the Philadelphia chromosome. This was in 1961, and Philadelphia chromosome was supposed to be the hallmark of chronic myeloid leukemia. So when we were students at that time, the knowledge about chronic myeloid leukemia was mainly about Philadelphia chromosome. Then in 1973, that is basically we were second year student. I was a second year student at that time, but I'm an MBBS student, but this knowledge was not known by that time. But Janet Rowley, an outstanding woman scientist of our era, Janet Rowley discovered that this Philadelphia chromosome is because of a translocation between two chromosomes, 9 and 22. So that the smaller part of the 22nd chromosome is what we see as the Philadelphia chromosome. And this was in 1973. So 1 decade later, knowledge was further advanced. 1985, it was found that at the site of this translocation, where two chromosomes bits joined, there is a fused gene, ABL and BCR. Two genes are fused together to form a fused transcript. This is 1985. Next decade, 1998, they came out with a drug that could target this abnormal protein, BCR-ABL, which is a tyrosine kinase, called imatinib. Now, the whole result of this was that something in 1960s, which was untreatable, something that almost always led to death within about 5 to 6 years or so on an average, it has now become a treatable disease. Many, many people are living for a very long period. Some of them are cured, in fact, because of this wonder new targeted therapy, which is, of course, the forerunner of so many targeted therapies now coming for treating cancer. So, this inherent progressive nature of science. So, what is this method of, if you go into this method of research in science, actually starts from an idea, then comes a question, then the question to a hypothesis, hypothesis leading to a prediction, prediction leading to further testing of that prediction by various means, and this process going again in a loop. Iteration is just repeating this again and again. So this is a essence of the research method. Now at this point, I think I will just throw open a poll. So you can maybe type in your comment box, which of the following is the most difficult part of research? So shall I stop the screen? Yeah.
Yes, sir.
So how do you? Okay, I think that's good enough.
Yes, sir. Almost everyone is telling
Almost.
about idea.
You see the screen now again?
Yes, sir. We can see that.
Okay. So no doubt about this that it is the idea. Everything else actually follows. So idea is probably the most important thing in research. It's the most creative part of research. Some people think that science is very non-creative, boring, unlike arts and literature and things, which are supposed to be very creative. But actually, science is probably the most creative of all. But that creativity part of it comes in the original idea. So where do these ideas come from? How is it that you get ideas? It's not very easy, like Isaac Newton sitting under the apple tree, suddenly getting a pure inspiration, But I'm not really sure about the story about Newton, whether he was inspired by the falling apple. But anyway, that is the story that we have. Pure inspiration, sudden flashes of insight. But these are very, very rare. Most often, you get ideas from critical reading of published papers, reading of literature of scientific research, and a critical reading, not just reading something, accepting just out of hand, but a critical. It's a way of reading, where you really assess and how true it is, how important it is. All these things are important in reading a paper. One of the essential things in research methodology is how to read a paper or how to critically analyze a paper. I don't know whether it is there as part of your lectures, but that's very important. Then a conference or a seminar, when you attend, you may get a new idea. Simple observation of patients for clinical researchers, observing patients, you can get ideas. As a pathologist, I know that almost every day, I encounter something unknown. Every day. I would say something or not which is known. So any of this can be pursued into a research. So observing patients and the ways that they present it, these are extremely important. Speaking to us, other researchers in the field is very important. And sometimes new technologies, when they come, a question that, could not be done, asking a question which is not feasible, which was not testable, suddenly becomes testable, and so you can do. So polymerase chain reaction, when it came, you could ask so many new questions, because of this polymerase chain reaction. When gene sequencing, whole genome sequencing is now available, you can ask an entirely new lot of questions all over again. So new technologies. A doubt raised by a colleague or a student, an undergraduate student or colleague, anybody, will actually lead you to newer ideas. So these are the ways that you get basic ideas. And these ideas have now got to be converted to a question. And what's a question and hypothesis? Just one example I put here, what are the risk factors for stomach cancer in Thrissur district? I worked in Thrissur Medical College in the 1990s. And at that time, stomach cancer was very common there. I don't know how it's any longer common there. Anyway, that is why I put this question. What are the risk factors for stomach cancer? So that's a question, an open question. A hypothesis means you actually assume some things. So here I am not just asking what are the open question of risk factors, but I am assuming that consumption of pickled beef in patients who are Helicobacter infested is a risk factor. So that is what I will be primarily looking for in the study with this hypothesis in hand. So what about these questions? What are the really good qualities of a good question. A good question should be novel. Novelty is extremely important because there's no point in doing things that others have done again and again and again. Unfortunately, a lot of research that is done here in India has no novelty. People are even scared of novelty. I found that people are sometimes scared of novelty. Some students come and go to a guide and say that I want to do such a thing. So they would say, what is the literature? So there's no literature regarding that. Then how can you do it? That is what they ask. That is exactly why you should do it. No, isn't it? Because it is entirely novel. It is really worth doing. But people are discouraged of for novelty. That is the thing that we should avoid in research. There should be something new. In every research question that you ask, you should ask something new. Maybe some other people have done it, but you have reason to doubt whether in Kerala the situation is the same. So you can do that again. But in Kerala, is it different from that? So that is a novel question that maybe you may be asking, but some kind of novelty has to be there. Relevant. Is it relevant to our society, our place? So that is a very important criteria generally that people look, when funding research projects and all. Then, of course, measurability. Is it something that you can really measure with your tools that you have in hand? So do you have the tools to measure the implications of the questions that you are asking? Feasibility. Do you have the money to do it? And do you have the people to do it? Do you have the facilities to do it? So what is the impact of this study? How much impact will it have? Of course, basic research will have far higher impact than applied research. Though applied research is far more common, basic research has much more impact, but basic research, of course, needs more kind of fundamental equipment and more money and various other things. And a question that is also always should be asked is it an ethical question? So these are the characteristics of how you ask questions and a good question. When we talk of scientific medicine, we always say that modern medicine, it is different from all others because it is scientific medicine. Scientific medicine or modern medicine is the simple application of modern medicine to modern science to clinical medicine. And this started maybe in the 19th century or so. And last 200 years, this has again proved to be eminently successful because it has brought us all the, it has decreased mortality to such a great extent that the same time that modern medicine in the last 150 or 200 years, human population has exploded because so many of the diseases which were untreatable at one time could be controlled. Right now, in the times of Corona, we are seeing scientific medicine in its full glory, battling a huge epidemic, probably the kind of epidemic which would have killed many crores of people if it had come in the pre-modern era. Anyway, scientific medicine is not about use of high technology, but it is following of the scientific method. This is very important. High technology can be used even for most dubious purposes, and that does not make it science. It makes us something is science only because when that scientific method that I outlined earlier is followed. Actually, scientific medicine, you practice scientific medicine, it is very much similar to research. Each time that you see a patient, you are doing research on a small scale because you are following this method of science. And this is exactly the reason why what we do is scientific medicine. I'll just show an example and I'll stop with this, and I think so that we can spend a little bit of time on questions and answers. So this is a 32-year-old woman feeling tired all the time. So this is a situation, and you immediately make a hypothesis. Okay, this lady is having anemia. So that is your hypothesis. So you go on to test your hypothesis by looking at the conjunctiva. It is pale. Then you look at the complete blood count. You find that the hemoglobin is low, 9.7. Yes, it is anemia indeed. So on the one hand, you confirm that she is anemic because the hemoglobin is only 9.7 here. Then you note the MCV is only 69. So low MCV and a very large increased RDW, red cell distribution width. These are indications that this is probably iron deficiency anemia. So you have your hypothesis further that this is iron deficiency anemia, not just anemia. So this is iteration. You again improve your hypothesis. Then you look at the serum iron value, TIBC, serum ferritin, transferrin saturation. So this serum iron is low, TIBC is high, serum ferritin and transferrin saturation are low. So this tells me that this is definitely iron deficiency anemia. So I ask the question, will it improve with iron deficiency treatment, iron treatment? Then I will go on to give iron treatment and see again, is it improving or not? If it is not, then I have to rethink this whole thing again and ask this, form an entirely new hypothesis. If it is right, of course, then I am my final hypothesis was right and the patient also improves. So this is how we do clinical medicine. And this is how clinical medicine is nothing but scientific research. And scientific research, medical research is nothing but clinical medicine on a larger scale. So I will end here asking the question again, research is research rocket science? Just look at this man. This is Charles Darwin. And Charles Darwin, his idea was so simple. It's so simple. The idea that natural selection can drive evolution was such a simple thing that people later, they curse themselves, why did I not think of this very, very simple idea? So even simple ideas, simple techniques, all of this can be research, and they may have profound, there's no research probably having the kind of impact that Darwin's research ever had in entire biology. Research is definitely not about high technology and other things. It's a way of thinking, and sharpening that way of thinking, you can ask various questions. High technology, low technology, all that doesn't matter very much. So thank you.
Thank you, sir. We have a few questions in the chat box.
I will just stop the screen. How do I stop the screen?
Just stop presenting. Yeah, yes.
I'm only familiar with Zoom, basically.
Okay. Sir,
this is stop report.
Presenting icon there. You are yes, sir. Yes, sir. Stop presenting. Yes. Welcome, sir.
So you can ask either orally or as comments in the comment box. You can, or somebody can read that to me, and I can.
Yes, sir. Sure, sir. Abhana Priya has asked you a question. Sir, can you please explain briefly how can we do critical reading of published papers?
Basically, critical reading is evaluating the various parts of a paper. You know that a usual scientific paper has it is divided into certain segments. First is the abstract. in which the entire gist of an entire paper is there. So the use of abstract is that you read the abstract and decide whether you need to go further or not. Whether is it something that interests you? Is it something that you can't read all the papers that are published everywhere? So you have to make this decision. Graze at the abstract and decide whether you want to go further or not. If you decide yes, then you read the next parts. And in the parts, introduction of a paper will give you the background, and introduction is something that will actually tell you how it is, why somebody is doing that research. So background introduction will tell you why it is being done. That helps you always. It helps you to understand the setting in which this research is done. Then you go to the main part of the side, and the main single most important things that you want to find from that paper is, one, is the conclusions drawn valid or not? Or can I believe actually what this researcher is saying? Is it valid or not valid? So that, of course, you have to go into research, details of research methodology, whether the design is right, whether the methods used are right, and whether the statistical methods used are right, and all these things are important. So validity is something that you try to determine by looking at all this and say whether is it appropriate, is it correct, and so on. And secondly, you also find what is the effect size. So something may be very statistically valid, but the effect size may be very small, that it may not be useful for you clinically. So that is the other thing that you want to make out from reading this paper. So for this, of course, you need to know a little bit more detail about research methodologies also, statistical evaluation, and so on. So this is something that you learn as you go along by reading more and more papers.
Thank you, sir. We have next question. Sir, when we try to do a new research with a novel idea, it would be difficult to do literature search and find references, right? Will it affect the credibility of the paper?
No, this is the point I wanted to make, that the fact that if you search literature, of course, searching literature is again another thing that, another skill that you have to acquire, how to effectively search literature, and particularly how to search PubMed. PubMed is the portal that is most widely used for searching literature. How effectively you can use this PubMed interface for medical research, which is huge. PubMed, from PubMed, actually you can, this is again another full big topic, of PubMed, how to search PubMed and find out various things. And now from that portal of PubMed, you can not only get literature, you can go to genes and the gene databases and so many other things. So how you can make use of it is very important. You should, just like the essential principles are similar to Google search, but with certain refinements, you can get the things that you want. Because importance of searching and getting out results is that you want to get manageable. What you ask for, you should get few papers. You should not be landed up with 1 lakh papers and so on, which means that your search is not effective. So that is one thing. So something that is entirely novel may not have the same things, in the form of already published literature. So that should be understood, and when you are creating a proposal, it should be mentioned that, okay, there's nobody else has done this in the world so far. I'm the first one who is trying to do it. So there's no harm in doing that, and I think that those should be the papers which should be very highly valued.
Thank you, sir. We have another question. Sir, could you share a few anecdotes from your experience in medical research? Were there any difficulties you faced, and how did you overcome them?
That offhand, I don't know what are one of my research areas has been sickle cell anemia. Sickle cell anemia in you know that sickle cell anemia is prevalent, very widely prevalent in certain districts of Kerala, Wayanad district, for example, Attapadi area in Palakkad district. These are the two places where we have plenty of sickle cell anemia cases. And these are mostly seen in certain communities, particularly tribal communities. There's another community called Wayanad and Chettis. These are the, so incidentally, I should tell you that when I went to work in Calicut after my post-graduation, my impression was that sickle cell anemia is a disease seen in Africans. And that was what I was taught in my medical classes in Trivandrum Medical College, where I studied MBBS. And subsequently, when I did MD in All India Institute in Delhi, the patients with sickle cell anemia that I had seen at that time were these Nigerian students who had come to Delhi to study and so on. So I didn't know that this was very near home. You had so many of these patients. So this was because it was not at all a well-studied condition at that time. And so it was that I, along with a friend of mine, who had joined as a postgraduate student there, we decided that we'll go and investigate this matter. And we didn't have any research fund or anything, So we used to take the one microscope and all other things packed together in few bags, go in a KSRTC bus to Wayanad. And we initially, the first camp that we set up, it was in front of a shop. We put some bench and chairs and bench, and there were of course some local people were there to assist us, particularly those associated with my Kerala Sahitya Parishad people, workers, friends of mine. They had arranged the so-called camp in a shop veranda, and that is where the first patients came. And that particular day, you wouldn't believe that we were wondering, we came all this way and maybe we'll not get any positive case. We were doing the sickling test. At that time, we didn't do electrophoresis or any sophisticated test. Sickling test, you do a sickling, and then one person would collect the blood and make a sickle preparation. Other will sit with a microscope and see whether I was sitting with the microscope and looking at the very first blood that I came under my microscope. Oh, it was suddenly, it turned into sickle shape. That was the first. It was a really, I wouldn't say, I don't know whether it is the thrill of research, which I experienced for the first time, was seeing this under my microscope, all the sickle cell. And that particular day, this is a place called Chiral in Wayanad, I remember. And 35 to 40% of all people we tested that day were sickle positive. Of course, they were not all patients, but most of them are carriers. But very high incidence was there in that particular area. And this is something that I can never forget. So initial, I wouldn't say difficulties, obstacles or anything, but by today's standards, maybe it was tough, to get there and do these things. So it is this excitement that should drive you, basically. The results, would eventually be so exciting that it can drive you on and on.
Thank you, sir. We have another question from Jessia. Sir, suppose we try to develop an entirely new method for our research and there are no or little references. It can be difficult to even find a guide, right? So how should we go about it?
I don't know. The guides have to change attitudes. I find that the attitudes in the older generation has to change much more than the younger ones. So what you said is absolutely true. This happens, the guides may be sometimes reluctant to take on new things. Basically, one of the things I always feel that something, the biggest inhibiting factor for us Indians, I would say, is fear of failure. Fear of failure is something that inhibits us, Unlike a typical Western European, they will go ahead and really, despite all this, they will go ahead. Somehow, this is something holding us back. I think we have to get over that. Failure is always part of research. Any kind of research, it is more often it will be a failure than success. You may get negative results again and again and again. So you shouldn't be disheartened by that. But the very fact that you tested something and found it negative is also important. So I think we have to get over this big block, which is the fear of failure. I don't know about how we can change guides and other things. I really am not really confident enough to answer. I think we have to, as a society, we have to change, So maybe the change and the drive for change will come from you, from your generation. I hope so.
Thank you, sir. We have another question from Aisha Jalil. Sir, suppose we come across an unusual finding in a patient for a particular disease. How many minimum of similar cases do we need to do a research on that?
That's, I think when you see an unusual case, you have to make an assessment that is it the rarest of the rare, just occurring by chance? Is it a one gene, one family gene genetic abnormality? Now we are looking into many of these rare genetic disorders. In fact, we have a entire big research program based in Delhi, actually, incorporating many medical colleges. Calicut Medical College is one of them. Looking at these rare genetic disorders, where very rare genetic disorders may occur only in just one family. So it may be just in one family, but that disease may be a mutation that occurred in some member or ancestor in the family. It is just limited to that family. So such a thing can be uncovered now. We have now tools for uncovering such things using whole genome sequencing technologies now. So in such a case, one thing you can always report it as a case report or a case series in multiple members of the family. And another very important thing about this rare genetic disorders, which may not be occurring anywhere else, is that it gives you clue regarding certain pathogenetic mechanisms. So suppose one example I would say is, there's one family, there was a case with cardiomyopathy, big heart in several members. So they isolated the gene responsible for that. It is the only in that particular family, and that gene they studied further. And the mechanism of the gene could be further studied, and they isolated this gene, and they put this gene into zebrafish model, and lo and behold, the zebrafish developed big heart. The zebrafish embryos, they put this gene into the zebrafish embryos, and suddenly zebrafish muscle hypertrophied, and they had big hearts. So through that rare diseases, these genes you can separate, and you can investigate about the action of genes and how they act, how they on other tissues and so on in various animal models and other things. Now that apart, you also got to make out whether is it really just familial, or is it possible that this is there in more than one family? Is it in an entire community? because India, we have this endogamous communities. Unfortunately, the bane of our whole country has been the caste system, where we follow this endogamous marriage pattern, so that but one side effect of this pernicious practice is that we have certain diseases more in certain community groups because they are endogamous. So is it in one whole group of people, do they have more disease, or is it more general and more related to the environment? In that case, you should be looking for the environmental factors which are responsible for this. So at this stage itself, you ask multiple questions and decide which is the line of inquiry that you should be taking.
Thank you, sir. We have another question from Vinay Prakash. Sir, if your research spans over multiple medical domains, is it necessary you require multiple guides, or could you get it published by yourself?
Generally, what we do in such situations is to have one guide and have co-guides. So there will be one guide, and you will have multiple, maybe more than one in different departments. Co-guides will be there. That is how it is done.
Thank you, sir. Sir, some papers are paid. We can't access many journals online. Is there some sites or journals which provide credible papers?
Pardon, I didn't get it really.
Sir, while searching for literature online, some papers are paid and we don't have free access to those papers. So is there some sites or journals which provide credible papers?
Yeah, generally the trend that is slowly emerging is to go for open publishing. So particularly in Corona period, most journals have actually all the papers related to Corona, they are giving it free now. So the open systems are going to prevail in the end. So meanwhile, maybe you can take a little shortcuts, I don't know, it is called piracy or whatever name is given for that. But you have these sites like Sci-Hub. Have you heard of Sci-Hub? SCIHUB. SCIHUB. Okay,
No, sir,
this is a site that was started by a young lady from Kazakhstan. Elbakan, her name is Elbakan. She was in her early 20s when she linked up all the libraries from all over the world. She linked, and in this site you can go and put the DOI string, you just cut and paste into that, and you can virtually get any paper. I extensively use it, in fact, and maybe you should also try that. So, because basically I feel that this knowledge should be open and free for all. So just limiting it to by various means and making profit out of it is unethical. So I have no qualms in actually using these piracy models to break that.
Thank you, sir. And we have a final question from Neha. Sir, in terms of quantifying or measuring results in behavior analysis studies, using forms seems a bit unreliable. Are there other ways to execute studies of that sort?
No, I couldn't hear that. What is unreliable?
Sir, mostly while taking behavioral studies, we use questionnaires or forms. So that seems a bit unreliable, right? So is there any other ways to execute studies of that sort?
Basically, behavioral studies, psychological studies are a big problem actually, because inherently in that subject you have these problems, So people now use various methods in addition to just simply getting this questionnaires and converting into quantitative numbers. In addition to that, people also use other approaches like qualitative research. Qualitative research is an entirely different form of research, where another way of getting, because of the inherent problems in psychology and behavioral research, people are employing various different means also, in addition to this traditional questionnaire based things.